For infertility treatment, reproductive surgery, advanced urologic care, and other minimally invasive gynecological procedures, assisted reproductive technologies, and men's health concerns, wouldn't you like a specialist with the best skills and most advanced treatments? How do you find a doctor who's right for you? This short video presented by Health Connections at today's TMJ4.com will introduce you to the experts at Reproductive Specialty Center. Learn about their state-of-the-art customized care. Dr. Janik, a reproductive endocrinology and infertility specialist, is here to tell us more.
The Reproductive Specialty Center really has three aspects. One is the infertility treatments. The other is our minimally invasive surgery, which does overlap with infertility, but we also have other patients that have either pelvic pain, need a hysterectomy, prolapse, other types of advanced gynecology problems. And the third aspect is the advanced urology care, which includes male factor infertility and men's health. At the Reproductive Center, we're very lucky to have all subspecialists in one unit, so we can take care of the couple as a group. In the example of male factor, it requires reproductive endocrinology and it requires reproductive urology to be working together. In this way, we can see the patient at one chart, have a unified treatment plan, so the patient is not going multiple places or have disjointed care. Of all patients that come through the door, about 2/3 of patients will become pregnant using first-line therapy. Then another 1/3 will need to move on to advanced therapy. And these are all forms of assisted reproductive technology, the most commonly known being in vitro fertilization.
We started with artificial insemination and, worked toward using some fertility drugs. And finally, it was determined that the in vitro fertilization would be the best direction for us. And it worked, first try. And
Well, our in vitro fertilization success rates are high for two reasons. One is just excellence and careful technique in all the areas that we do. How tight you are with ultrasound, with lab tests, drug individualization, all those things help you to have a good success rate. In addition, we have advanced techniques that we've incorporated in, such as blastocyst transfer, which is transferring the embryos on day 5 after we can select the better embryos, and doing this under ultrasound guidance so we can see exactly where to put the embryos within the uterus. Typically, patients are transferred on day 3 because it takes a very good lab in order to maintain the embryos to day 5. You have to have very exact culture conditions, and we have an excellent embryologist, Dr. Mark Dow, that works with us that has brought this technology to the Reproductive Center.
I think if you really, really want to have a baby, you can have a baby. I mean, there's so much out there, and I mean, he's here now, it was worth it.
Couples often choose the Reproductive Specialty Center as a place to have their treatment because we're known to have excellence in all areas of what you would need, whether it's in vitro fertilization, surgery, male treatment. And in addition, your treatment will be individualized to what you as a couple need in the most effective way possible.
We trusted Dr. Janik and the staff. The staff is amazing. When you're going through some of these procedures, you're not just coming here once a month. There was a point where I was coming in here every day for, a week at a time and working with the same people. And I couldn't have done that if I didn't feel comfortable working with them, and trusting them is a big part of it.
We've made some observations as we've worked closer together in the last couple of years in some gynecologic problems that cross over into the world of urology as well. Specifically, we have found that a number of ladies who have problems with pelvic pain related to endometriosis also have a problem with their bladder, specifically the lining of the bladder, a condition called interstitial cystitis. And we have observed in our collaborative efforts, Dr. Janik, Dr. Coe, and myself, that these ladies may have both of those disease processes happening at the same time, where previously one or the other has been missed. And so I think our unique situation of working side by side in the office, in the operating room, has been a great blessing for a number of our patients as well as to us.
I ended up coming here because my bladder fell and my rectum fell. And they were basically hanging out, bulging. I knew every bathroom in every restaurant and in every gas station, every department store, and every mall in the city of Milwaukee. And I didn't like frequenting them. I'd rather have spent my time shopping or enjoying my dinner. My regular doctor said that I needed to see a specialist. I needed to see a specialist who was both skilled in urology and in gynecology. So she gave me some options, and I did some research, and I chose Dr. Dwyer and Dr. Cole. Well, I chose them because they are pioneers in their field, and they were able to do the surgery with very little, very few incisions. And I think they call it non-invasive, and I liked hearing that. And I read about Dr. Coe on his website, and he seemed very skilled. He had patented several devices in his profession, and I was very comfortable. And then I came here and I interviewed both of the doctors, and I was sure I had selected the right people. So the operation that I required was a rectocele and a cystocele operation to repair that. 10 weeks to the day later, I feel fine, I feel great, and I haven't felt this good in 5 years.
I'm Dr. Charles Coe, and I came to Milwaukee in 1977 from London, England, where I did my training in gynecology. And one of the things that I did was microsurgery, which was to repair fallopian tubes using very, very fine suture. Since being here in 1990, we started adapting that technique to laparoscopy, and our group was the first in the world to put tubes together through the laparoscope using microsutures. Since that time, we've been doing a steady amount of tubal reversals, and our pregnancy rate is about 88% in a year. Other kinds of things that we do all relate to minimally invasive surgery or laparoscopy. Women with very large fibroids or multiple fibroids who want to preserve the uterus for childbearing can undergo a laparoscopic procedure where the fibroids are removed with a few little incisions, and they go home the same day. I introduced a method for performing total laparoscopic hysterectomy in 1996, and I have a patent, and the method is called the co-colpotomizer. This method has been adopted in many, many centers throughout the nation and worldwide. Over here, since we are the originals, we are able to do almost all hysterectomies by laparoscopy, and we have not had to do a big incision on any woman in the last 12 years that we think can have a hysterectomy by laparoscopy.
This is a world-class facility. Because of our activities in research and teaching, we are on the cutting edge of new technology, and many patients will fly in from all over the country and the world to seek treatment here.
Offering the most advanced surgical and non-surgical techniques for a wide range of infertility, gynecology, and urology problems. Visit our website to read the doctor's bios and more information on services. Known for their leading skills and customized treatments, this video has covered the highlights of Reproductive Specialty Center. For more information or to make an appointment, call 414-289-9668. Wouldn't you like the highest level of expert care? Take the first step today.